Thank you all for joining today. I am going to hand it over for opening remarks to the Director of SAMHSA's Office of Recovery.
Great. Thank you so much, everyone, for joining our first ever Sparking Recovery quarterly event. And we have an outstanding event that we've planned for you here today. My name is Paolo Del Vecchio. I'm the Director of SAMHSA's Office of Recovery. And I'm also a person in long-term recovery myself from mental health addictions and trauma as well. And I'm not alone. Certainly through data that we released last September for Recovery Month, we know that there are over 50 million Americans like myself who identify as being in recovery. What that translates into, about 70% of all individuals who've had a mental health or addiction issue identify as being in recovery. So what that really does say is that recovery is common and in fact should be the expectation for all behavioral health systems across the United States. Next slide, please. At SAMHSA, we see the necessity and the importance of recovery and recovery-focused, recovery-centered approaches. We're not satisfied with the 70%. We want to make sure that recovery and recovery support services are available to all. But as you can see from this slide, this shows SAMHSA's strategic plan for 2023 through 2026 and identifying our 5 key priority areas and then 4 key principles. And as you can see at the bottom of the graphic, recovery is one of our key cross-cutting principles as we're focusing on improving the behavioral health of the nation. Next slide, please. SAMHSA's Office of Recovery, and one way we're doing that is in fact through SAMHSA's Office of Recovery. SAMHSA's Office of Recovery is the first ever federal office within SAMHSA dedicated, in fact, to advancing recovery across the nation. We're new. We're only about 18 months old at this point, but we've been very busy and we continue to be busy because of the huge needs that exist across the country for recovery and recovery supports. The first year of the planning for the Office of Recovery, we met with recovery community leaders and allies across the country to help develop a national recovery agenda on what should be our focus. What we heard from the folks is the importance of taking a Big Ten approach when it comes to recovery. That means including mental health and addictions. It means focusing on people in recovery as well as family members. And it means also addressing equity and diversity in all of its aspects. So taking a Big Ten approach is one of the key drivers for our office. As you can see here, our mission, in fact, is to forge partnerships to help pursue recovery, build resilience, and achieve wellness. Next slide. We're doing this through 5 specific goals that we've identified. The first is inclusion, the old adage of nothing about us without us, the absolute necessity of involving people in recovery and family members in all aspects of behavioral health care. It also means inclusion. It means addressing the need for social inclusion and reducing what's been called stigma, discrimination, and prejudice that's placed on those of us with mental health and addiction issues. Our second goal is equity, and this is all about recovery for all, with a particular focus on expanding recovery support services to underrepresented and underserved populations. And in support of this particular goal, we help to launch SPARK, SAMHSA's program to advance recovery knowledge, that is helping to convene this particular event today. We also have the goal of peer services and really expanding peer-provided services in every community across the nation. Our fourth goal is around social determinants of recovery, the importance of things like housing supports, the importance of things like employment and community, that help to promote our recovery. We talk about health, home, purpose, and community as key building blocks of recovery. And our final goal here is on wellness. And really, this is about making sure and encouraging and supporting people to live longer, healthier, fuller lives. We know we die too young from preventable chronic primary health conditions primarily. So we really need to do a better job in terms of promoting whole health perspectives, whole person perspectives, and promoting wellness. I mentioned Spark as one of our key activities, and we really see Spark on the next slide, please, as a key aspect for our work in terms of really carrying out this mission. As noted here, Spark is a National Technical Assistance Center, and in fact is designed to support us in our goal of pursuing recovery, resilience, and wellness. And, to learn more about Spark, we're going to talk about more about Spark here in this meeting, but there is our website, samhsa.gov/Spark. Next slide. So these are some of the key priorities as Spark gets underway. And again, these very much align, as you can see, with SAMHSA's National Recovery Agenda. The inclusion of people with lived and living experience to formulate solutions to ensure recovery supports are equitably accessible to everyone. The need for equity for minoritized and marginalized communities. The delivery of authentic peer recovery supports. The importance of addressing social determinants of recovery, and in fact, the expansion of recovery-oriented systems of care and recovery-oriented practices. Next slide shows that we've assembled just an outstanding team to carry out Spark here, and that's led by the principal C4 Innovations. Team that they've pulled together for this work includes our partners at NASHBID as states, the Alliance for Rights in Recovery, formerly NIAPSRS, the National Council for Mental Well-Being, Faces and Voices of Recovery, Advocates for Human Potential, and the Center for Applied Research Solutions. We really believe that this is a dream team, so to speak, to help us with our goal in terms of advancing recovery across the nation, and for Spark with a particular focus on equity. I'm really excited that you were able to join with us today. At this point, I'm going to turn the next part of our agenda over to Wendy White-Tygreen. Wendy, over to you.
Thank you so much, Paolo, and what an exciting day to be here with all of you. We're just delighted to get to share some time with you. I'm serving as a facilitator today of our time together. I also serve as the director in the state of Georgia for the Office of Medicaid Coordination and Health System Innovation for the state's Department of Behavioral Health and Developmental Disabilities. And I've consulted in many of your states around peer support and recovery financing, and I'm just delighted to be here with you. Next slide. So first, I just want to share the agenda with everyone for the day. So we're going to have the opening remarks we just wrapped up, the introduction, which I'm proceeding with through right now. And then we're going to have a brief focus on workforce development. And then we're going to, and that's a sum of 3 presenters. And then we're going to open it up to some folks to reflect on that content based on their experiences. And we are going to focus every time we're together on 3 levels, local, state, and national or federal reflections. And so we have partners today to do that reflecting work. We're going to then pivot to some SAMHSA Office of Recovery updates. NASHBID, NASDAD updates will be a standard on the agenda, and then we will move to the closing remarks for the day. Next slide. Thanks. So as Paolo referenced, I'm going to share a little bit more about the way we've built this agenda today. We know this is a first session. It's a kickoff. And we have worked with SAMHSA to keep this Sparking Recovery event really focused on the strategic plan priorities that Paolo mentioned. Looking at the priority areas, which are identified here at the top, but also the dimensions of recovery, as he mentioned. So just be mindful that as we proceed today and in future sessions, we are keeping all of this as our philosophical foundation for everything that we are going to press ahead. Next slide. And the quarterly sparking event, of course, those dimensions of recovery you see here at the top, there are cross-cutting themes that are crucial to all the work that we do. And so what you see, I'm not sure, did the slide, there you go. Okay. So things like Paolo mentioned, like equity and financing, lifespan, workforce, those are things that are crucial to this group. And what you see here is a framework where you see this first flag in Navy. That's this event, this quarterly sparking recovery event. And then when we wrap up today, we are going to facilitate with some federal leaders some reflections and dialogues on this work. And then process kind of how federal agencies together can work to better support some of the emerging content and topics we share here. And then if technical assistance needs emerge from these meetings, then create strategies to roll out focused TA on these elements. And then it would cycle back to the next quarterly event. So we're really creating a CQI cycle. We feel like that's very crucial to the body of work to consider the feedback loops and how the event is being received, so that we can bring back information to everybody who's participating, we hope on a regular basis, to have advancing learning together as a team. Next slide. So I do want to just bring up that we are deeming ourselves like as a learning community, right? We are coming together in this group. We hope to see you quarter after quarter and to get you really engaged in this as a community. And so I do just want to share then some basic foundation content here related to that. As a community, we have community norms, and so we want to lay out a few, and then I'm sure more will emerge as we proceed together in this community. But we are a team pulling together about a recovery, and so respect is going to be at the core of how we interface together. So we challenge you, sometimes you may hear some things you might not agree with, engage with that with respect and dignity. The chat is open. We encourage you to chat. And because we don't have a lot of time with this big group to do open Q&A, so place questions in the chat and just engage with one another, support one another. When you hear something you love, chat it out. And when you hear something you have a question about, question it. And again, but just anchor in respect. As Paolo mentioned, from the initial learnings from the core, mental health and addiction, substance use are crucial to this. And so we are keeping that in play. And then person first and respectful language will be what we try to use with regularity. And we'll just also point out that there are different naming conventions for things in different states. So peer supports or recovery supports or certified peer specialists are called things in different states and different areas. So just roll with the language. I think we in general as a community will begin to understand our shared language and begin to kind of respect that and create that cultural norm as well. So with that, I want to kick it over to Rachel, who is here from SAMHSA, and let her introduce herself. Kristen Harper, who's here, and just be sure that she introduces herself and moves into her body of presentation. So again, welcome everyone.
Thank you so much, Wendy. It's wonderful to be with you all here today. Just seeing all the names pop up in the chat, it's so cool to see so many people that I haven't connected with in a long time for such a wonderful topic. I'm privileged to be a public health advisor at the Office of Recovery at SAMHSA, and work with our incredible team on Spark and a few other initiatives, which I'll tell you about a couple here in just a second. I do identify as a person living in long-term recovery from mental health and substance use conditions, and have been working in the field in recovery support services for about 18 years now, and have been with the federal government for 2 years, and I'm still alive, so you can do it. So I'm going to kick it over to the next slide now, and I'm going to tell you a little bit about one of our events that we had last year. That was a phenomenal event. Some of you were there actually that are here. If you want to share your impressions from the meeting, please do. If you were present for Peer Possibilities 2023. Just briefly, a quick summary of that meeting. The purpose of that meeting was for SAMHSA, for us to solicit feedback from stakeholders to better understand the variables that impact the expansion of the peer workforce, as well as identify gaps and scalable solutions to increase peer support across the country. We'll go to the next slide. So over the course of about 2 days, we had a little over 100 participants in that meeting from a variety of different backgrounds, mostly peers though, or those that employ peers or fund peers participated. We did have some federal agencies, some partners come in and also participate in the meeting, which was really nice to get them engaged. But we had some common themes emerge, and I just wanted to touch on those briefly for the purpose of this meeting today. We'll go to the next slide. So the first one, I think Wendy may have kind of teed me up here for this first one. Defining the term peer was a major part of the discussion. And you'll see here from some of the context on the slide, we had a variety of different sort of pathways, if you will, to the intersection of peer, both in mental health and substance use, and family and youth recovery support services. And so the term peer supporter, peer worker, and peer specialist were interchangeably used to describe a person, including family, friends, and loved ones with lived or living experience involved with problematic mental health and or substance use conditions, and who engage in a wide range of activities, including advocacy, linkage to resources, etc. I'm sure I don't have to tell this group. The next theme that emerged was surrounding the history of both mental health and substance use recovery advocacy and peer recovery support services, including certification and the growth throughout the states. And so we touched on a little bit of that. The next theme was the peer community is not homogeneous. And so we are comprised of many different backgrounds, many different and diverse aspects of the peer community. We were really fortunate to come together during this meeting to hear various experiences, both lived and living experiences. We did include a focus on inclusion of members from the disability community, Black and African Americans, those who practice harm reduction and non-abstinent approaches, and then family and parent peers were also represented there as well. We'll go to the next slide. The federal partners need more peer input. That was fairly clear. We do have some really wonderful federal partners, but we want to encourage all of the federal agencies to continue to include lived and living experience and expertise in decision-making process. I'm sure Paula will probably mention this at some point, but we do have a really exceptional policy at SAMHSA called the inclusion policy that he actually developed, got approved, and has implemented throughout the agency, which encourages and requires every single layer of decision-making at SAMHSA to have the inclusion of people with lived and living experience. If you'd like to see a copy of that policy, we can share that with you. Just reach out to us and we'd be happy to. We also, a couple more of the themes within the clinical systems need to be recovery friendly, and this really produced a robust conversation around person-centered care versus the disease model type of care that we've seen historically. And so we had some really great discussion on next steps that we can take within that theme. And then the peer role is valuable and should be protected. And so we had some really great conversations around authentic peer services, the integrity of the peer role, how to protect those regardless of what setting peers are working in. and that continues to be an emerging issue. The next one was financing barriers that limit peer effort. And of course, you know, we're always trying to unpack the Medicaid bundle and figure out how we can secure additional funding pathways and diversify funding streams. So we had some really great presenters talk about braiding services along with some reporting to create administrative burdens and taking some of those burdens off the peer leaders and away from doing more direct service delivery. And so we're continuing to having discussions on that. And then the peer career issues are a symptom. I thought that was a great takeaway. The low pay, burnout, lack of workforce, I don't have to tell this group again, are symptoms of an unhealthy system. Peer burnout and well-being cannot be rectified without addressing the systemic environment in which they operate. So all of these themes, and we'll go to the next slide, have played into some suggested thoughts of moving forward. And we're actually going to have our second peer workforce meeting in August of this year to continue some of these conversations, but then also to look at the solutions that were recommended from 2023 and continue to move forward. So the first one is broker more conversations. And of course, that meeting in August that's coming up is one thing that we're doing with that, but we're also continuing to have conversations within SAMHSA, but then also interagency-wide across various parts of the federal government about the inclusion of peer services at various levels, how to pay for it, how to protect it, et cetera. And then also, we want to encourage more conversations within the workforce itself. And Spark is one way that we're doing that, and there's a couple of other mechanisms where we're able to support additional convenings and conversations. Also, the important role of the community-based organizations or CBOs, and of course, recovery community organizations. And there is a critical component there that we're also hoping to infuse peers throughout communities by the use of these peer and community-based organizations. We'll go to the next slide. And then elevate equity concerns, provide better understanding of federal assets and barriers, and address the peer role drift, which of course, all three of those, elevate equity, better understanding of federal assets, and address the peer role drift, really speak to this need to slow down a bit and to take a look at some of the complexities that are wrapped up within the federal assets and barriers. And then also, how are we authentically infusing our equity priorities within either newer systems or some of these systems that we're trying to rebuild. And then the peer role drift, of course, you all know that there is an incredible focus on defining the peer recovery support specialists, recovery coaches, peers, family peers, and making sure they're not being asked to do things that don't fall within their role. And so we're working on that as well. And then another suggestion was provide clarity on the intersection of recovery and harm reduction services and approaches. And there is another upcoming meeting that my colleague David Awadala will be hosting on this particular topic. And we're really excited to see what comes from that discussion and that convening as well over the summer. And we'll go to the next slide. And I just would love to say just a quick thank you for those of you that were at the meeting in 2023. We're very grateful for your input, and just know that we have taken all the information gained from that meeting and have infused it through all of our work for 2024, and we're planning for 2025. So thank you so much to the committee for asking me to speak, and I will give it back over to Wendy.
Hi, everyone. I'm going to introduce our next presenter. Lori Johnson Wade is joining us, and she has been a leader in the Peer Recovery Center of Excellence. And Lori, I'm going to go ahead and kick it to you without further ado.
Oh, thank you so much, Wendy. Hello, everybody. I'm really excited to be with everybody today. Lori Johnson Wade. I'm from New Kensington, Pennsylvania. I'm here today on behalf of the Peer Recovery Center of Excellence. I serve as the steering committee member liaison for Core Team 3, which is workforce development. I have been in recovery in 8 days. It'll be 33 years on the recovery road, and it's really been an exciting journey. It's afforded me a lot of opportunities, being a wife, a mother, a grandmother. Along with my husband, started an RCO in New Kensington, Pennsylvania called Lost Streams Awaken Center. I also serve on the board of directors for Faces and Voices of Recovery. I'm a charter member of Black Faces, Black Voices. All that is due to recovery, because I made a decision on May 30th of 1991 to embark on this journey. So I'm really, I want to use the word sparked about being here today. Also want to honor our history. My being here today in this moment is on the shoulders of great folks who came before us and paved the way with advocacy and labors of love. I always say before peer was a job, it was a movement. And so I want to honor that. We are living in the fruits of our predecessors' labor, and I would be remiss not to mention that. So let me share some wonderful work from the Peer Recovery Center of Excellence with you. It is really a wonderful organization, and they have done some stellar work over the last 4 years, of which I'm going to share many of those resources with you today. So who are we, right? So the Peer Recovery Center of Excellence, some of you may know it by the PRCOE, was funded by SAMHSA in 2020. First of its kind, to provide training and technical assistance to the peer workforce, RCOs, or recovery community organizations, recovery centers, other orgs that are in the ecosystem of recovery to support the implementation of peer recovery support services. I grew up with PRSS, and it's housed in the Missouri Kansas City University with the Collaborative to Advance Health Services. Next slide. And so the mission, vision, and guiding principles of the Peer Recovery Center of Excellence envisions a world where the peer workforce is diverse, it's understood, it's valued, trained, and integrated across systems. We have 4 pillars that we seek to uphold through our work: and social justice and equity, values rooted in recovery, peer leadership, multiple pathways to recovery. And so we build and elevate equitable peer workforce to deliver the recovery support services needed across the ecosystem. Next slide, please. Okay, this is an image of our core team. So these are our focus areas. And if you go starting at the top with the peer integration, our partner in that is the National Council. And so going clockwise to the right, RCO capacity building, our partner is the University of Wisconsin-Madison. And with workforce development, which is my core team, I work with Maureen Nichols. She is a champion, and she's at the University of Texas, Austin. And then UMKC works with evidence-based practices. We have a new core team liaison there, and I'll introduce you to all the core team members, steering committee members shortly. And then this is what I get so jazzed about: health equity. That's our most recently added core team. And we are really excited with One World Recovery Network being the partner for that. Next slide, please. Okay, here's the fabulous steering committee. All of us have lived and living experience. Joanna Dolan, she is for peer integration. Dr. Hanir Hernandez, he does health equity. Sharon Hesseltine, she chairs the committee. Dr. Anawa Lavelle, she's our newest steering committee member, and she does evidence-based practices. Nell Hurley does RCO capacity building. Of course, I've already mentioned my core team several times, core team 3, workforce development, and Michael King steers our organizational stakeholders. Next slide. All right, so the PRCOE is really one of our primary functions was to do technical assistance. And so we divide into 4 focus areas, and the way that we provide technical assistance under the guidance of our steering committee is that people can take a very simple process of submitting a request. Then somebody contacts that person to discuss it, and then we create a plan to deliver the technical assistance, and then we deliver it, and then we get we survey it and get feedback on the particular technical assistance that is delivered. So just wanted to realize everybody to realize that that's one of our primary focuses, and it's essential for the transfer of knowledge from one party to another. And it takes on many forms, including sharing information, distributing educational resources, providing skills training, mentorship, project consultation, networking, curriculum development, and more. Next slide. Okay, so I want to spend most of the time introducing you to some resources that you may be familiar with, perhaps you're not, but they are at your disposal. You can use them. They're in a repository. You can access them. But one that really we were proud of is the needs assessment. And so the purpose of the needs assessment was to determine strengths of currently operating RCOs. So talking to the people, right? Determining needs of the RCOs to best inform and prioritize future trainings and assistance offerings. So what do we put on the menu, right? What do folks need? The best way to find that out is to ask. And so doing that assessment, and then identifying gaps in services and RCO resources for future considerations was a big aspect of that. So this multi-pronged approach of looking at the needs assessment of RCOs within the 10 HHS regions was to really determine strengths and challenges across RCO setting types in order to guide the future endeavors of the center, specifically through the provision of learning collaboratives and technical assistance. And we used digital surveys, regional stakeholder interviews, regional listening sessions, and we were able to identify gaps in services, RCO resources, as well as an informed prioritization of future trainings and assistance offerings. This information not only serves as guidance for the PRCOE, but is also available for those serving in any capacity within an RCO who might be seeking direction in allocating resources, financial or otherwise. We know that recovery is possible, and this hope inspires us to believe in the power of the collective. And so we do really embrace the participatory process in gathering information. Together, we work towards building and strengthening the capacity of RCOs, and there will be a link to this particular report, this particular resource provided for you after this presentation. Next slide. Okay, here was another product that really was done so well and again engaged that same data collection process, and that's defining peer support worker job roles and tasks. And so this was a well-crafted job descriptions, an essential part of recruiting, hiring, and onboarding. Developing job descriptions help. And in this particular guide, you can access these tools for your organizations, but developing job descriptions to help teams clarify the specific needs of your program, ensuring that positions you hire for fit the program design, looking at pre-hire effective job descriptions for everybody to know both ways. It even gives some guidelines on interviewing processes. This tool helps define what peer practice means for your organization. It helps identify the specific competencies, core tasks, and responsibilities for peer support workers in your program. Consider some unique challenges in recruiting, hiring, and onboarding. It goes into some of those nuances that aren't always found in readily available resources. You will also receive this link. Next slide. Okay, here are two wonderful products that were produced for the peer workforce, for workforce development. And these are the peer recovery support evolving roles and settings. And then there was an update in year 2, a literature review done relevant to this. So really pleased to share these tools for peers that serve many roles in many settings. Emerging research that explores the value of using peer recovery support services across various settings. This literature review, the most current, was put together in an effort to gather all of the information into one place, as well as identifying gaps in order to make recommendations for the future. Process improvement is really much a part of this. And you'll find an overview in these of current settings utilizing peer recovery support services, key findings, recommendations for future studies. This information deepens, promising, and there is much more to do to grow peer recovery support further. So just want to mention that in 2021, the National Council for Mental Wellbeing conducted this literature review, and to synthesize the current evidence related to the continued evolution of peer recovery support and the broader integration of peers into increasingly diversified community settings, as well as to identify persisting gaps in research. Since 2021, further research has been conducted on these topics with new and highly relevant themes, directions, and outcomes. And in an effort to continue highlighting emerging literature and best practices in the field, the National Council for Mental Wellbeing, one of the partners, has developed this document as an update to the previous literature review. So these two fine documents will be at your disposal. Next slide, please. Okay, so this is one that the Core Team 3 Workforce Development Team really worked hard on. All of them have a lot of effort put into them, but the comparative analysis of state requirements. This was quite an undertaking, and so we're really pleased to share this updated version of our comparative analysis of state requirements for peer support specialist training and certification in the whole United States. So in recent decades, there has been increased recognition of the value of peer recovery support services in the behavioral health field. And so as recognition and evidence for best practices continues to emerge, each state is continually updating its training and certification requirements to improve the quality and practices of peer support in their communities. The purpose of this report is to provide an overview of state peer recovery trainings and certifications, as well as provide recommendations to better support those individuals seeking information about the peer support specialist certification application process. This is a document that holds all of that at your fingertips. And so really having this, I know when I was up and coming in this work, having these resources would be like gold. So really take hold of these, use them as needed. They become very critical to creating systems and programs and doing these comparisons at your fingertips. So the information in the report reflects the current status of state-approved training and certification for behavioral health peer support specialists in the 50 U.S. states, the District of Columbia, the U.S. territories, including the American Samoa, Guam, Northern Marianas, and Puerto Rico, as of January 2nd, 2023. We always welcome any updates, changes. This is something that we are open to continuously improving as the information is available. Okay, next slide. Okay, so how about emerging practice areas? Now, this is not an exhaustive list. These are just some of the emergent practice areas that the Peer Recovery Center of Excellence is highlighting, and that's harm reduction and peer support. We know that this, it's not just emerging, it's here, right? So how are we moving beyond abstinence-based models? There's a podcast that you can tap into for your reference. Also, peers and doulas, right? Harm reduction for pregnant people. There's a podcast that's been produced for that. The intersection of harm reduction, prevention, and recovery. It's a learning community toolkit. And so integrating that into recovery spaces, traditional recovery spaces, these are toolkits that can be of assistance. Skill development series for peers, supporting people navigating crisis. This is also a podcast. Some other emerging practices on our purview are with young people, re-entry, and of course, as we continue to develop and evolve, we will continue to develop these practice areas. Next slide. Okay, so I'm really excited to share this particular database page. It's on the peerrecoverynow.org, peerrecoverynow.org. And this is a state certification database. It's very user-friendly. So if you go to peerrecoverynow.org, and if you have any updates or anything you'd like to advise us on, we welcome that by email at info@peerrecoverynow.org. And we will certainly get on that. Maureen Nichols is the keeper of this, and she's very good at making sure that updates are done expeditiously. So this state certification directory contains information regarding the training and certification processes for all 50 states, 5 U.S. territories, and the District of Columbia. The certification information in this directory covers state certification in mental health, substance use, integrated, family and adult. As you see on the pull down menu, you just click on what state you would like to access. Alabama is the first listed, and then you can click on what certification type you would like to see, and it will pull up all the information you need, and it's regularly updated. Because each state handles its own certification processes, they are ever changing. So I think I'm preaching to the choir here, but it may occasionally have old information. So if you see that your state's information is out of date or have any questions whatsoever, please contact us at this email address posted here, because that's critical to keeping our directory as stellar as we possibly can. And so, next slide. Okay, I just want to thank you. I want to thank you for your time. I want to thank you for the opportunity to share kind of where we have come to. It has been the dream of many that all these resources exist, that the peer recovery support service movement and professional aspects are really coming into their fullness. And I really celebrate that whole dream. This was just a dream of many. And so now it's up to us to carry all that forth. So that's my contact information. If I can help you in any way, it's my personal contact information. And of course, you can always reach out to the Peer Recovery Center of Excellence. They can also get a hold of me if I can personally help you with any workforce development challenges, opportunities. Thank you so much. And I am going to give it back to Miss Wendy.
Lori, thank you so much for your expertise, the expertise of the COE team, and for all the lived experience voices who feed your beautiful product. We really appreciate that. Next slide, please. So at this point, folks, you saw that Lori just had a moment in one slide to hit on some of the emerging practice trends for peer specialists. And so there's a few of these we wanted to dive into with a little bit more depth today. They're going to be quite superficial for the depth of each of these, the complexity of each of these, but we wanted to share some of this information because there is a lot of emerging space and place in which peer specialists can practice, and there's emerging ability to do so. So you see here just a representation of many of those, and we're going to touch a little bit on each of these areas in the next few slides. So next slide. So the first thing we're going to talk about is the emerging crisis continuum. And all of us know that in 2020, there was a 988 piece of legislation passed by Congress. And in it, it talked about not just 988 as a call number, but as a comprehensive crisis continuum. And peer specialists can be integral members of the workforce in a variety of places and spaces in that continuum, as you see here at the bottom of this screen. Next slide. And while nationally we talk a lot about the someone to call and someone to go and somewhere to go related to that continuum, when you think about it kind of from the range and the perspective of practicing peer specialist, I think it's also really important to think about this arrow right here, this continuum, thinking about it differently, which is certified peer specialists in the crisis system can really be about helping folks sustain recovery, do crisis prevention, do early crisis intervention. So before things escalate to a point of acute crisis, they can participate in intervention, and they are definitively so valuable in post-crisis support. So when we're talking about the addition of peer specialists to crisis teams, right, most all services are provided in some team framework. Even the call centers like have supervisors and other partnered folks who are generally in the call centers and in the call center domain so that they can support one another. I think it's just really important to think about the role of that certified peer specialist, which is unique. It's about really being able to introduce recovery concepts to individuals, broaden the capacity of the team. So multidisciplinary teams have different perspectives, and they bring different learning experiences to the table. Peer specialists should be impacting that to more effectively address the individual who is experiencing crisis. They can assist the individual in self-advocacy, hopefully avoid unnecessary out of home or out of community admissions to anything that's a higher acuity level of care. And we hope increase the engagement of individuals who have been frequently engaged in these supporting systems. Next slide, please. So here's just some brief resources. Again, we wish we had so much more time with you, and we'll look forward to that in the future. But there's some opportunities for learning here for everybody. Some of these are quite fresh. You see May 2024 on that first document. So that one's hot off the presses, and we will continue to share more of this information in the future with you. Next slide. So the next emerging huge area for opportunity are the certified community behavioral health clinics. So if you're not familiar with these, I hope you get familiar, and this will just be a little introduction to you. But in the early teens, Congress passed a piece of legislation that enabled the definition of a new practice model called Certified Community Behavioral Health Clinics. And what that is that's a comprehensive mental health and substance use community-based organization who has to do several required services to get certified and designated as a CCBHC. And you see from the bold blue arrow, we are so pleased that peer supports and family caregiver supports were named in the legislation. And if you didn't know, that was the first time that peer support was recognized in federal law. And so this was just a really exciting moment when the demonstration was put into law, because all of a sudden peer supports is actually in federal law. So we were very excited about that. Next slide. So when we're talking about peer support and family support as being mandatory services, there's not expansive detail on how to do this, but there is some current standard that is cited. And I think that's important for us to know what the standard is so we can continue to raise the bar and increase that visibility. So first, the workforce. The workforce is required. So the CCBHC is responsible for employing trained certified peer specialists and recovery coaches, as well as certified trained family peer specialists. CCBHCs are a whole lifespan service. And so looking at peer support for children and families, as well as for adults. And you see here a list of things where the CCBHCs are mandated to have a recovery orientation. And so you see many of the things here that are very recovery focused and clearly would be supported by peers. And the phrase that's used here from the standard is peers and allies. So very important recovery content built in with this peer support workforce requirement. Next slide, please. So here's the actual standard just for folks to see. Again, the mandatory standard related to the provision of peer and family support. And there's a lot of content here, like warm lines can be considered as part of those contracts, wellness and respite centers, crisis planning, peer navigators, self-help groups. So it's really exciting to see that all of this can ultimately be folded under a CCBHC umbrella, and whole costs are accounted for in the federal formula. The cost of these services ultimately creates the rate. So it really, CCBHC at its heart is a new financial pricing model for reimbursement of some services. So it helps these clinics be able to expand peer support over time without waiting for new appropriations, without looking for a new Medicaid billable code. So it's important to keep an eye out for how CCBHCs will continue to grow peer support services under their unique certified umbrella type. Next slide. And so things to keep an eye out for. So the standard allows direct or formal partnerships with CCBHCs through CBHCs with peer-run organizations. So be looking for those, encourage those, advocate for those. It expands and says other types of services under the CCBHC umbrella can be provided by peer providers, and keep an eye on state standards, because states can set a higher bar than the federal standard, just not a lower one. So we hope for more and more of that over time. Next slide. Next slide. So Lori referenced some hospital practice, and she referenced some practice for pregnant women. Just be aware that models are emerging for emergency departments and other practice areas in hospitals. And of course, peer specialists are thriving in some of these places, and great outcomes are being achieved. Next slide. Federally qualified health centers also are places and spaces where peer specialists are starting to be recognized to be able to do practice. And so again, be cognizant that under the umbrella of what the federal government qualifies as a health center, generally for individuals who are on Medicaid or experiencing a certain level of poverty. These centers have mandatory behavioral health benefits, and they have optional behavioral health benefits. And so many of the optional behavioral health benefits can utilize a certified peer specialist. Next slide. And I'm not going to go into this depth, but I think it's important. I've provided one state's information, Arizona, about how they define how peers can practice in that state. And just also be aware that federal HRSA defines this. They generally talk about, between states and the feds, behavioral health technicians or enabling staff. And under those definitions, a peer support specialist could qualify. And next and last slides. Medicare. We are very excited that Medicare is starting to recognize peer support workers as part of its policy and procedure. And there is a horizon all of its own on that we all need to be focused on and understanding for the future. But to begin with, just for a little while, since 2015, there has been an ability for some specialized programs that are performance-based, this MIP that you see here, merit-based incentive payment system, which has allowed actually entities to provide and promote self-management for health conditions, and they include peer support. So that was kind of a stretch. And so when you go to the next slide, you will see that there is new ability for peer specialists that's just been rolled out in the past year, where community health workers and peer specialists can do more service delivery under the billing auspices of an enrolled physician. Now, we got to establish partners between physicians and peer specialists, and we've got to develop team models which promote that. So finally, Lori mentioned several of these, so I'm not going to spend a lot of time, but any new opportunities, all of these exploding opportunities, supervision is crucial. The supervisor understanding the role of the peer specialist. Often these are non-recovery oriented systems of care. And so we want peers to be able to thrive and feel culturally welcome in those environments. And how does that start to work? And of course, the roll, tug, and drift that Lori mentioned, and Kristen mentioned. But again, the opportunities, my friend Sherry Jenkins Tucker in Georgia always said there's no wrong place for a peer specialist. And in our hearts, we believe that. And there's boundless opportunities. Okay, so with that, next slide. We are going to pivot to our local, our reflections suite, and we're going to have 3 folks reflecting. So we're going to begin with Heather Rodriguez to give a local recovery reflection from what we have heard today.
Thank you, Wendy, and good afternoon, everyone, if it is afternoon wherever you're at. And first and foremost, I just want to thank the organizers for inviting me to participate in this kickoff quarterly meeting. It's really exciting to be here with you all, and certainly a lot of great information has been shared. And so my name is Heather Rodriguez. As Wendy mentioned, I'm the Vice President of Recovery and Advocacy Programs with Mental Health America of Indiana. I'm the director of the Indiana Recovery Network and director of Indiana Addictions Issues Coalition. I also identify as a person in sustained recovery. And just a little bit of information about the work I do. I have had the honor of working alongside recovery community organizations, a variety of grassroots, community-based recovery-focused organizations that are peer-led and driven. So all the information shared today really just makes me so happy to hear about the advancement in the recovery movement nationally and the efforts that SAMHSA collectively is putting behind advancing the movement and the efforts we are all doing around the country. And so probably like many of you, I took a whole bunch of notes, and so I'm going to try to make it make sense the best I can in the next couple of minutes. And so first, I just want to say, touch on what Kristen shared about the emerging themes from the meeting that was held in August of last year. I was happy to hear the themes and the needs identified, right? Because those are the same things we hear about here in Indiana, the local recovery organizations and from the peer recovery support service providers throughout the state. And so I'm happy to hear there is intentionality on the part of SAMHSA, Spark, and the Peer Center of Excellence to really listen to the voice of the people who are providing the direct services, the organizations employing peers and supervising peers, and really trying to find creative solutions to support those efforts and to really lift up those voices and advance the movement through trainings, technical assistance, and all the great things that are offered. So I just wanted to touch on that as well. And then really appreciate the effort of Spark and SAMHSA even, because Paulo touched on that too, about focusing on equity and inclusion. We know that recovery and the recovery landscape looks different in so many areas, right? Certainly Indiana is not unique. We have a lot of rural areas, a lot of underserved communities, urban rural mixed communities, and the needs are different, and their voices should be heard. And I'm happy to hear that the federal entities are listening to those voices and really finding solutions for that. And so just for the sake of time, that's kind of my first, I guess, reflections to offer. I'm looking forward to more of these quarterly meetings and hopefully connecting with some of you on this meeting today. So thank you so much.
Thank you, Heather. And we'll kick it to Noah. Noah, just introduce yourself and jump right in.
Good afternoon, everybody. My name is Noah Abdenor. I'm the Director of Peer Support and Recovery at Texas Health and Human Services Commission. Our team oversees kind of 2 main things. One is the broader workforce, the peer workforce. So we oversee the certification and then support the training, and then the broader stakeholders that may or may not work inside of state-funded programs. And then we oversee the programs and projects that the state funds to deliver recovery or peer services. Thinking about this topic, there's like 3 ways that we're operationalizing supporting our workforce. And I think the topics that were brought up before really align with the way that we're looking to support the growth of these services across the state. First and foremost, we created a training support hub to support the peer workforce, whether that's learning about how to get certified as either a peer specialist or family peer specialist, how to obtain supervision, being connected to support as a peer worker. I think that's something we hear from our community often is a lot of peer specialists are working isolated in different organizations and don't always have a supervisor that fully understands the role. So we use this training support hub. It's called PeerForce to be able to support the broader workforce. Another piece that we're doing is we're providing targeted technical assistance to organizations that employ peer specialists, whether those are clinical organizations. We're trying to get support to them, not only on the implementation of peer services, but also how to incorporate recovery more broadly into everything that they're doing. And I think what we know about peer specialists is we exist inside of a recovery paradigm. And sometimes the organizations that we may be working in don't always fully understand that. And so we want to get support to our clinical partners so that they can fully understand and incorporate these values, not only in delivering peer services, but more broadly into everything that they're doing. Another piece of that technical assistance is going towards supporting the growth and the creation of more peer or community-based organizations where we can operate in. We really want to encourage the use of that designated, the DCO designation under the CCBHC. Sorry for the acronyms there. But we think that's a mechanism of partnership between our clinical organizations and peer support organizations where the clinical folks can leverage these peer organizations to deliver these services. So we're trying to facilitate more partnership there. The third thing that we're doing, I think maybe the most important, is we're looking to pilot new funding mechanisms so that we can use contracts to partner with community-based organizations or peer-run organizations to distribute funds. And I think that's a way that we can create more leadership opportunities for peer specialists and people with lived experience, because we know these community providers that are experts in recovery, they're going to be hiring people like myself who are peer specialists to move into these other administrative roles. So we see that as a strong place to grow the field. So those are a couple ways that Texas is implementing strategies to support our workforce. And I'll hand it over.
Thanks, Noah. And then next, we're going to kick this to Georgia Simpson, who is with the HHS Minority Health Office. Georgia, welcome.
Georgia Simpson. I'm the Regional Minority Health Analyst, actually in Region 1, so I cover the 6 New England states, but I've had the really good fortune of running an HHS CHW interagency sustainability working group with Captain David Wong for several years. Captain Wong, I just have to give you an incredible shout out and statement of gratitude for all that you've done in this space. Many of you may have had the opportunity to speak with Captain Wong, to collaborate with Captain Wong, but he has been a tremendous visionary as it relates to the CHW workforce and sustainability and other lived experience workforces. So I just had to put that out there. He has since transitioned, still in OASH, but doing another role. One of the things I want to share is OMH leads the CHW Interagency Sustainability Work Group, and it is a representation or represented by about 35 individuals from 9 HHS agencies, including SAMHSA. So thank you, SAMHSA, for being there as a partner always. The platform for this work group is really around exchanging and sharing some of what we heard today. How do we get federal agencies to learn more about these lived experience workforces? And from my perspective, the CHW workforce in particular. But it doesn't stop there. As we had these conversations, we learned that there is a lot to be done hand in hand with our peer support workforce. There's a lot to learn. And so I come here in the spirit of learning. One of the things that we managed to launch as a result of the working group was a national peer support and CHW national organization leaders conversation. This conversation was hugely important, and it was so that we can each learn from one another, but also see where we could support each other moving forward. Interprofessional collaboration opportunities, looking at identifying and promoting best practices. And I can tell you, honestly, one of the things that came out is that we learned that the peer support workforce had made significant advancements in areas that were very important to the CHW workforce. And so some of those were shared today. And I was so happy to hear like, oh, I remember that group. I remember talking to them. And so, you know, very gracious of you to open up your learnings, your experience to us as CHW allies and supporters to understand how things work. One of those areas is the Medicaid reimbursement. And so, as you know, peer support reimbursement is in almost every state in the country. It's not the same for CHWs. It's probably just less than half of the states in the country reimburse for CHW services. So what we decided to do is maybe we could take that national model of bringing the two workforces together for a conversation and have it happen in the state. And so my dear colleague, Stephen Fry, in your SAMHSA Office of Recovery, has been working with me on these conversations, and they've been hugely successful in having the peer supporters share their journey with the CHWs on how Medicaid reimbursement has worked in the state. The other is around the training and technical assistance that you all have stood up, which is huge. It's incredibly strong. And so the Peer Recovery Center of Excellence, CHWs do not have a center of excellence. We had the conversation with the partners there on how do you do it? What does it look like? What does it take? What can we learn from that? The National Association of State Mental Health Program Directors, thank you too for sharing your knowledge and expertise in the area of peer support TA. And then lastly, I would mention like NAPS, National Association of Peer Supporters, who gave CHWs the opportunity to present at their annual conference. It was, I believe it was probably the first time ever. And that was an opportunity to kind of break down the silos and begin to foster these conversations. Yes, we invited ourselves to the party, but that's okay. We were welcomed. And then, of course, there's reciprocity that has to be done here. The CHWs finally got a standalone profile in the Bureau of Labor Statistics Occupational Outlook Handbook, first time ever. And within that new profile, which launched in September 2023, not only were we able to identify and promote the CHW workforce and have understanding of what the role is, what it provides, the expertise, we also had real estate, as they call it, on the page to identify promotores, the community health representatives, and of course, peer supporters. So I just want to thank you all again, and I hope to continue to walk side by side as we learn of the lived experience workforces and where there are opportunities. And that's it for me.
Thank you so much, Georgia. And we are so grateful for a lot of the work that you did in getting some of those classifications across the bow. So thank you. And thank you for being here with us. Folks, we are going to shift a little bit. We want to learn some more about all of you. We're getting to know you in our chat as a community member, but we've got just a couple of poll questions. They're super simple. So we would like for you to go ahead and respond to this series of 3 questions so that we can know who has joined and know what we want to contemplate in the future. So please go ahead and everybody individually fill out this. You see the first question today is in joining this event among this grouping types, which role do you primarily see yourself in? Remember, we open this up to all folks who are interested in sparking recovery. So as Amy replied in the chat, it could be all different folks who are here. So please fill in that item. So the third question was then considering future events, topics of interest. and picking 3 of those. So we kind of just get a little bit of a sense from all of you in the future in terms of being community respondents about where your interests lie in the future. Okay, for time, we are going to go ahead and close the poll at this point and go ahead and look at the results, just so you all know who's here as well. Fabulous. Look at all those peer support staff. And of course, we see a lot of folks we've got a diversity of folks in terms of roles among the second grouping, national, state, local folks. The 2 locals together would equal 53%. So a lot of local participation. That's incredible. And so we see the emerging items on question 3. And so are very delighted to see that content as well. So with that, folks, we got a little bit of sense of the community, and I'm going to pivot over now to Captain Wanda Finch with the SAMHSA Office of Recovery for some office updates.
Thank you, Wendy, and good afternoon, everyone. Thank you so much for joining us today. I know we're running a little bit behind time, but I'm going to do my best to get through all of these wonderful updates from the SAMHSA Office of Recovery. And first, let me identify myself as an ally to people with lived experience and people seeking recovery as well. First off, hot off the press is our SAMHSA Office of Recovery 2024 Art of Recovery project. We just announced this about a week, maybe 2 weeks ago. This project aims to highlight the transformative impact of art on mental health and substance use recovery. We are going to seek submissions from youth. About 150 and 350 adult submissions will be posted in a virtual gallery. Artists can submit 1 piece of art along with a brief description of the inspiration behind the artwork. Selected artwork, including a brief description of the inspiration behind the work, will be posted on SAMHSA's website as part of an online exhibit called the Gallery of Hope, Artistic Expressions of Recovery Across the Nation. And submissions are accepted through June 28th, 2024. I've put the link in the chat, so please share broadly. And the online gallery will launch in September 2024 and run throughout the month of September to celebrate National Recovery Month. And it's not too early to start planning for Recovery Month. We will also be celebrating with a Walk for Recovery on September 5th from 2 p.m. to 5 p.m. Eastern Time. The walk will begin at Freedom Plaza in Washington, D.C., headed to the Washington Monument, and ending at the Sylvan Theater, which is right on the foothills of the African American Museum, for those of you who have been to Washington lately. Also, to close Recovery Month, we will also host an award ceremony that recognizes the contributions of people in recovery, family members, youth, young adults, and allies in helping to advance recovery across the nation. On September 24th, SAMHSA will recognize 8 honorees, including young adults, family leadership, and also legacy or legendary pioneers, data reports on the prevalence of recovery, and including special attention to proven significance of arts and recovery exhibited in the innovative programs and approaches, providing innovative strategies that include the adoption of expressive activities and other new and inventive forms of recovery, resilience, and intervention tools that promote recovery. The ceremony will also feature an in-person gallery exhibition of the Art of Recovery project, as I just mentioned. So stay tuned for more updates on that. The Office of Recovery has been very busy hosting a series of policy meetings, and I'm just going to quickly go through the titles if I can. We have completed earlier this month a community meeting with the LGBTIA+ community in or seeking recovery and identified gaps and scalable solutions to increase recovery supports and innovative approaches. Upcoming, we have an intersection of harm reduction and recovery meeting, and this meeting will explore opportunities to expand collaboration and how to overcome barriers. We will host a national peer-run crisis respite dialogue. This will be a 2-day virtual meeting with a group of subject matter experts to collaborate on enhancing knowledge about financing of peer-run crisis respites and promoting equitable access to deliver behavioral health care across the continuum. We will also host a webinar on June 28th that will focus on the psychiatric advanced directives to promote community living. And this is in honor of the 25th anniversary of the U.S. Supreme Court's decision on the Olmstead. So this will be another exciting opportunity. The registration link will be shared soon. We will also host a Power of Peers meeting that builds on the 2023 meeting that Ms. Harper spoke about earlier. And this meeting has a focused priority theme on DEIA in relation to the peer workforce. And last but certainly not least, we're going to end the year with a couple of other meetings, one focused on rural recovery to enhance the knowledge and delivery of peer-based and recovery support services, wellness in the workplace, which will convene both federal and non-federal stakeholders to discuss innovative approaches for identifying and creating employment opportunities and a recovery-ready and wellness initiatives in the workplace. A national family supporting recovery meeting. This will convene a diverse group of family leaders from across the nation to share their experiences with the loved one based on their specific role as a family member, as well as their needs for peer services in that role. We also have a Spark regional meeting that will be convening in Kansas City, focusing on leadership development of state recovery leadership to drive meaningful change, foster resilience within their communities, and cultivate leadership capacity within their organizations. And if you missed it, we convened our last quarterly Office of Recovery Exchange meeting was held on April 29th. We did record the event, and I'm posting that in the chat as well if you'd like to have an opportunity to revisit that and listen in. And we also have a number of reports that we have released, including the research report, a technical expert panel, peers and psychiatry dialogue, and 2 regional community meeting reports have also been posted to the Office of Recovery website. And funding announcements, I'm sure everyone is so excited to hear about this. SAMHSA has a couple of new funding opportunities. One is the National Peer Run Training and Technical Assistance Center for Addiction Recovery Support. We like to call it CARS. Applications will be due July 22nd. And the chat will be the link will be in the chat for you to access this at your convenience. And additional SAMHSA funding opportunities are also available, including a focus on minority fellowship programming to reduce disparities, cooperative agreements for the Garrett Lee Smith, the Addiction Technology Transfer Center Cooperative Agreement, the National Center for Mental Health Dissemination, Implementation, and Sustainment Cooperative Agreement, and more. And I will put the SAMHSA link in the chat so you can find out about those opportunities and more on the SAMHSA grant page. Back to you, Wendy.
Thank you, Captain Finch. And I'm going to turn it over for our last few minutes to Amy Brinkley, who is the Recovery Support Services Coordinator for the National Association of State Mental Health Program Directors. Amy.
Thank you, Wendy. Good afternoon, everybody. I'm excited to be here. Unfortunately, I'm in a hotel, so the lighting's not that great, so I apologize for that. But I just wanted to say, and I'll try to be quick because I know we only have a few moments here, that I'm just so excited for this first quarterly Sparking Recovery event. We've been planning this for a while now, and we're kicking this off in Mental Health Awareness Month. So we're just really excited, and we're really excited with this turnout. So for the NASPID update, I'm going to keep it brief this time around because we just have a few moments here. But NASPID hired 2 people, myself and Justin Volpe, 2 years ago. And our role has been to serve as liaisons to the National Division of Recovery Support Services, essentially your offices of recovery within the state mental health authorities. And we've really been working significantly with SAMHSA's Office of Recovery and with our state offices of recovery and trying to bridge this gap. And so I'll share 2 resources to our website, and I will share that one of these links takes you to, nope, that's not it. One of these, oh, that is it, but the link didn't move over. I'll put the links in the chat, or we'll send it out after. So you can actually find out who your state Office of Recovery director is on our website. And then we also have a return on investment research paper on our website as well. And so if you have any questions about who your Office of Recovery representative is, you can go to our website and find that information out. And it is 3:29. We are so excited that you guys are all here, and we look forward to our next event. So Wendy, I will go ahead and pass it back to you.
Thank you, Amy. And we just want to say to everybody, we are just so pleased with the participation today for the kickoff of the quarterly Sparking Recovery events. Please stay tuned. Please share with your friends. And we are looking forward to being back with you guys later this year with our next event. And as you see, we are passionate about this work and passionate about sharing lived experience voices and recovery work with all of you. Thank you so much. And we look forward to seeing you just around the corner. Thank you to everybody.
Do I need to go? Is that all?
We are good.
Thank you, thank you, thank you, thank you. Amazing. It was
Good job,
so
Noah.
good. Yeah.
Thank you so
That
much,
was smooth.
folks.
Is this like a just y'all debrief?
No, I think
well,
we're
we're
gonna
just saying
close out.
thank you. Yeah.
Yeah.
we-
Okay.
We'll
Didn't know if
talk
I was, like,
further
crashing
via
a party
email.
here.
No, you're great.
yeah.
Thank you.
No,
Thank you all so much.
thank you.
Smooth as
right.
silk. Awesome. Great job, y'all.
Bye,
Thank you.
folks.
You
Thank
take
you,
good
Noah.
care.
Thank you, Laurie.